Some people snore through their noses. What I have learned from a lot of people that have helped people who have chronic snoring issues is there are a lot of things you can do at home to fix this. There's surgeries, which absolutely work. Sometimes with sleep apnea, it's the tongue, other issues. But the first thing is chronic congestion, because what we know is during allergy season, snoring and sleep apnea go through the roof. That's not an accident. That's because your nose gets clogged, right? And you're breathing through the mouth. Another thing is during the day, we are breathing so heavily, like over breathing all day long, that we carry that over to night. So what these people do, there's a bunch of different things. You can put a little tape on your mouth. You can sleep on your side. But one of the main things they do is to train you to breathe very lightly during the day. Just that breathing that we were doing. For instance, if I were to ask you to breathe heavily through your mouth right now and make a snoring sound, how hard is that? Okay, you can do this without a very, very rich snoring sound. There it is. Now breathe very slowly in and out through the nose and try to make that same sound very slowly with your mouth closed and try to make that sound. A lot of people say this is a mechanical thing. You're over breathing.
I can't do it.
There's too much air flowing in. And so you make that snoring sound. Sleep apnea is a different thing. That's when you choke on yourself. It can be from your tongue. Most of the time, the tongue is falling back, or there's constriction. If you are morbidly obese, very obese, you can get this lateral compression against the throat, right? And there's some things that happen in the nose. People are given CPAPs as a cure for it. It cures nothing. CPAPs can actually make your sleep apnea worse over time. And around 50% of people given CPAPs within a few months aren't going to use them anyway, but they're too embarrassed to give them back to their doctor. So to be clear, if you have sleep apnea, these things are an amazing Band-Aid to get you over that hump. You can't be choking at night, but it's not fixing the core issue. The core issue for so many people is that mouth that is too small for your face. It's an airway that is not properly developed. The back of our airways is covered in this flesh, right? That flesh needs to be firm, right? We exercise everything else in our bodies, right? Our muscles, our biceps, our legs, but we're not exercising our airway. So you can do this with exercises, with myofunctional therapy, very stupid name for an amazing therapy that allows people to stiffen those tissues, to allow you to take that easy breath without any constriction so that you don't snore.
I guess I've been told I snore, but I think it's just sometimes, it's just kind of occasional. But I certainly understand how, like, just starting to breathe through your nose